Male pattern baldness. In the latter part of the video, you will be able to find best and effective methods to get rid of male pattern baldness. So be patient and watch till the end, you'll be benefited for sure. Male pattern baldness refers to a loss of hair on the scalp in men. It happens as hormone levels change over a man's lifetime, and especially in the later years. Before embark on the topic, subscribe the channel to get more information about baldness. Male pattern baldness is related to your genes and male sex hormones. It usually follows a pattern of receding hairline and hair thinning on the crown. Each strand of hair sits in a tiny hole, cavity, in the skin called a follicle. Generally, baldness occurs when the hair follicle shrinks over time, resulting in shorter and finer hair. Eventually, the follicle does not grow new hair. If the follicles remain alive, which suggests that it is still possible to grow new hair. The typical pattern of male baldness begins at the hairline. The hairline gradually moves backward, recedes, and forms an M shape. Eventually the hair becomes finer, shorter, and thinner, and creates a U-shaped, or horseshoe, pattern of hair around the sides of the head. Classic male pattern baldness is usually diagnosed based on the appearance and pattern of the hair loss. Hair loss may be due to other conditions. This may be true if hair loss occurs in patches, you shed a lot of hair, your hair breaks, or you have hair loss along with redness, scaling, pus, or pain. A skin biopsy, blood tests, or other procedures may be needed to diagnose other disorders that cause hair loss. Hair analysis is not accurate for diagnosing hair loss due to nutritional or similar disorders. Treatment is not necessary if you are comfortable with your appearance. Hair weaving, hairpieces, or change of hairstyle may disguise the hair loss. This is usually the least expensive and safest approach for male baldness. Medicines that treat male pattern baldness include minoxidil, Rogaine, a solution that is applied directly to the scalp to stimulate the hair follicles. It slows hair loss for many men, and some men grow new hair. But the problem is hair loss returns when you stop using this medicine. Finasteride is a pill that interferes with the production of a highly active form of testosterone that is linked to baldness. It slows hair loss. It works slightly better than minoxidil. Here also the hair loss returns when you stop using this medicine. Finasteride is sold under the name of Propecia, Proscar. Now Finasteride is combined with minoxidil and used as a topical solution. Dutasteride is a similar medicine like Finasteride, but may be more effective. Hair transplantation is another form of treatment, which consists of removing tiny plugs of hair from areas where the hair is continuing to grow and placing them in areas that are balding. This can cause minor scarring and possibly infection. The procedure usually requires multiple sessions and may be expensive. Another method used is suturing hairpieces to the scalp, which is not recommended as it can result in scars, infections, and abscess of the scalp. The use of hair implants made of artificial fibers was banned by the FDA because of the high rate of infection. So it's always advised to consult your dermatologist to find your suitable treatment plan. If you are happy with your baldness, then it's totally okay, as male pattern baldness does not indicate a medical disorder, but it may affect self-esteem or cause anxiety. There are videos about individual treatments and their shortcomings and side effects in the queue. Stay connected with the channel by simply subscribing and pressing the bell icon. Thanks for watching.